Dental practitioners need to know that this technology is safe with the proper training. They need to understand this is not a medical grade CT machine, that the amount of exposure can be anywhere from 4 to 240 microsieverts based on the machinery that you're using. And the proper training for their team and staff is going to be really very important overall. So you can minimize that field of view, take the area of question in your mind that you need the view of, and always remember to start out with your periapical radiographs or panoramic radiographs, and cone beam should be the last choice for if you're having a tough time making a diagnosis, allowing the cone beam to help you with that final diagnosis. And it is the treatment standard of choice, say with implant planning. That's the standard of care these days. In my opinion, cone beam is definitely becoming the standard of care for implant placement in dental practices. The amount of information that can be gained off of a cone beam, we be able to visualize and picture that anatomy before you're doing any types of surgery or diagnosis. You cannot get anywhere else. Will it become mainstream? That's a great question. I don't think it will become mainstream for a while, but it certainly it has its place as one of our finest tools in dentistry today. Team training is really so important. No matter what vendor you're purchasing from, you have to know that team training is going to take place the day of install. They're going to spend a full day with you, and then they're going to be available for your team at any time of the day. They'll come back and retrain. You got a new staff member, a new team member came in. That you have online video training available for you as well. I mean, that's just so critical. I want to know that my staff can call up at any time if we're having a problem with the machine and reach an IT person. They can get on our machinery, get on our computer, and find out what's going on, what's wrong. So yeah, I want to make sure it's not a fly-by-night company. Okay, legal issues with CBCT is the fact that if you take a large field of view image, say your dental assistant accidentally did that. Okay, all of a sudden you got this wide area of the maxillofacial region that you were not intending to take a picture of. You really have to get that type of image read by a maxillofacial radiologist or radiologist who specializes in the head and neck region to protect yourself against any potential legalities later on in life if the patient developed a tumor or a cyst, something undiagnosed. For the limited field of view, you don't have to concern yourself with it. Obviously, if you saw some pathology, then you would need to refer that out to that radiologist. You want to have a radiologist on board who you work with. I think it's really good to partner up. A lot of the cone beam companies have radiologist systems already in place to allow you to work with them. So that's a question to ask one of your vendors. The best way a general dentist can know if a cone beam is right for them, for their practice, is really, you have to sit down and ask yourself, what are you going to use it for? Are you going to be placing implants? Are you going to be restoring implants and treatment planning the case with your oral surgeon or periodontist? Are you doing endo in your office? Do you see a lot of emergencies? You really have to evaluate the type of work you want to be doing and see if that fits into your thinking pattern. And will it have a natural fit for your practice growth? I think those are the main questions that you need to ask yourself. I mean, I sat down and I planned out what I was going to be using it for over a period of time.